Hi, my name is Josie Feeney, and I chose to do my Sportsmed 3 medical journal research project on stem cell research. There we go. First of all, to start off, what is a stem cell? Stem cells are immortal and typically, if they're in the right environment, will specialize, will differentiate, will become functional tissues. What does this mean? This means that stem cells are the future of what medicine can do to treat different diseases. Stem cells are essentially blank cells that can be harvested and manipulated and can be turned into any cell that is needed in the body. These cells can be harvested from places like your skin, and then they can be reverted into a blank cell. They can also be harvested from your blood system, such as your bone marrow. And stem cells have many different uses within the body and many different uses to treat many different diseases. It is important to look at stem cell research because this is, again, the future of what medicine is going to be able to do to treat different diseases. So, knowing what they are is going to help people going into the future, seeing what different medical journals and research institutions can do. Going off on the uses of stem cells. Here's just a couple ways that stem cells can be used. One of them is to treat certain types of blood cancer, such as leukemia, lymphoma, myeloma, and a couple others that I'll touch on later. The other one is regenerative medicine or organ generation. Stem cells can be guided into becoming specific cells that can be used in people to regenerate and repair tissue that have been damaged and affected by disease. These can be used to help people with spinal cord injuries, so we can turn stem cells and try to turn them into nerve cells to help regain feeling and sensation and maybe even motor function in people who have suffered spinal cord injuries. Type 1 diabetics, if diabetics experience any sort of skin deterioration when you have diabetes, if you get a cut, you have to be very careful and watch that it heals properly. Sometimes you get what's called a diabetic ulcer, and that's terrible, and that's a lot of the time why diabetics will get amputations is from ulcers that greatly affect whatever appendage or part of the body that that's on. So stem cells could be used to fix those, and they can also help in burns. So burn patients, you can potentially use stem cells to kind of regenerate that skin tissue to heal the burn. Drug testing. Before testing drugs in people, researchers will use stem cells to test drugs first on the stem cells and then see if the drug can be used. It gives a better inclination on if the drug can be used on people. So, for example, nerve cells could be generated to test a new drug for a nerve disease. And stem cell healing response, which Tanasi has talked about in class, this can be used in orthopedic injuries, and it is basically stem cells are injected into like a vasculature system to repair damaged cells and stimulate tissue regeneration with growth factors. So basically, if you have an ACL tear or a meniscus tear, you'd put stem cells, inject them, and hope that they would kind of help the tissue repair itself. Stem cell healing response isn't fully proven on if it works or not, but it's a cool topic and it gives a better idea on maybe another future of what stem cells can do. I also want to touch on some controversy in stem cell usage. So a lot of stem cells are harvested from embryos, and that's why they're called embryonic stem cells. They come from embryos that are 3 to 5 days old, and these are the most versatile, and they can become any cell in the body. The other type of stem cells that are used are adult stem cells. You typically get fewer and less versatile stem cells from adults, but there's less ethics involved in this. Adult stem cells have limited ability, and they are also exposed to environmental hazards, such as abnormalities in genetics and stuff like that that adults have experienced. Um, some people are concerned about using embryos and embryonic stem cells because they come from embryos. Um, they come from eggs that are fertilized, typically in vitro fertilization, which is a fertility treatment that people have received. And typically, these embryos that embryonic stem cells come from are basically unused embryos that parents have not used, and they donate to research from a fertility clinic. The concerns in controversy and ethics with this is like that parents aren't informed, people who've received IVF treatment aren't informed on what they're giving the embryos to, but it's a matter of informed consent, and as long as the people know what they're donating their embryos to, it's fine as long as they're informed as to what they're being used for, which is great things. Now I want to do a deep dive into stem cell regeneration. These cells can be manipulated into anything, so potentially we could make a kidney from stem cells and use that to transplant instead of like getting a donor kidney and that. So regeneration could completely change the world of organ transplants. There is a lot of unknown in this area. There's a ton of gray area. And it is a study that I read said at least 10 years away, but it could be more. There's not yet been like a stem cell generated kidney or organ of any sorts, but studies on mice have shown that stem cells can repair damaged organ tissue. So this is, again, really promising as to what stem cells can do and how they can help the future of medicine. Going a little bit deeper, I'm going to touch on a stem cell transplant. This is used, also called a bone marrow transplant, and it is used as cancer treatment for blood cancer. There are two types of stem cell transplants, similar to what like an ACL repair would be, but you have an autologous transplant, which is stem cells harvested from yourself, and an allogeneic transplant, which is donor stem cells. An auto transplant is when they collect your stem cells and then you would blast the patient with chemo, infuse the patient with their own stem cells that have been filtered for any cancer. Then you inject the stem cells back into them, and then you basically help the patient nurture their new immune system. You make sure that they don't get sick. You make sure that like food poisoning is a really, really, really big factor. You want to make sure that people do not get food poisoning after stem cell transplants. Typically, patients will be in the hospital for about a month, receiving, again, harvesting the stem cells, blasting the patient with chemo, and re-injecting and making sure that the patient is stable. With an allo transplant, it's similar but a little bit different. You collect donor cells and bone marrow. This is typically done this procedure is typically done in an operating room by a doctor. So you collect your donor cells and bone marrow. You blast your patient with chemo, get all of their cancer out basically, infuse the patient with stem cells, and protect the patient's immune system. The other thing to be aware of with allogeneic transplants is GVHD, or graft versus host disease, which is basically the patient's immune system attacking the new stem cells and bone marrow that they have received. This is a long-term condition that is a risk with these types of transplants, but it's really the risk of GVHD or cancer. So it's a pretty obvious choice with that one. But this can be treated with steroid injections, and oral rounds of oral chemo pills to kind of act as immunosuppressants and immunoboosters to, again, balance out graft versus host disease. These two types of transplants are used for different types of blood cancers. So an autologous is typically used to treat lymphoma, which is a cancer of white blood cells and lymph nodes, and myeloma, which is cancer of plasma and bone marrow. Um, Allogeneic transplants are typically used to treat leukemia, which is cancer of blood-forming tissues, and myelodysplastic syndromes, which is immature blood cells that form into cancer cells. Thank you for listening to my presentation, and I hope you learned something about stem cells.